here at the Zofan International Hospital. Ladies and gentlemen, fellow students, you are all welcome to this presentation by me, Michale, a student of TCM in the Zofan International Hospital. Actually, I want us to think for a moment about a disease that can affect everybody, whether it's a male or female, whether it's from the eastern part of the world, north, western, or whichever part of the world, whichever skin color, whichever tribe or age, especially when it has to do with the adulthood. It's something that affects everybody within the group. So it doesn't have any ethnic barrier or race barrier. It's something that affects both gender and also affects us all. And is in many countries one of the deadliest diseases. Like in China, if it's not the first, it's the second deadliest disease we have, and that is the stroke. Some call it apoplexy, but the popular name for it is stroke. In Chinese name, we call it wind stroke. We have reasons for that. We'll come to that. So the presentation today is about a stroke. So by the time we are through with the presentation today, we will have come to a conclusion of how the Western medicine view the stroke, then also how the TCM view the stroke, how the Western medicine treats the stroke, and how the TCM approaches their own treatment. Then we are going to compare and see the advantage over one over the other. So it's something that has been happening for a very long time, but it's something that also from time to time has different kinds of symptoms. But first of all, let's define it first and see from the Western point of view how they view this disease called stroke or apoplexy. So stroke, what is it? From the Western point of view, it is a condition that affects the brain cells, whereby if the brain lacks oxygen to support itself from the blood, then it can happen. And so there are some certain things that may result as it is caused. So some of those problems are going to be itemized in the future, but first we have to understand that it's a condition that affects the cells of the brain when they have no oxygen. There is a shortage supply of oxygen from it. And then in the Western point of view, we have basically there are two types of stroke. We have the ischemic stroke and the hemorrhagic stroke. But there's another type of stroke. That one is called TIA, that's the transient ischemic attack. It's like a mini stroke, call that a mini stroke because the lifespan normally doesn't last more than 24 hours. But what of this ischemic and the hemorrhagic stroke, which is the popular name for the two types of stroke we have in the Western medicine? For the ischemic stroke, it is a blockage of blood from the meridians, a free-floating clot. It could be from blood, maybe it's blood stagnation or fats that store up in a particular angle in the arteries, or a substance from the leg can flow up to the brain because there are veins and arteries that moves down up to the brain. So when this free flow of substances move up to the brain, they can go and cause a blockage, and then there will be no free flow of blood to the brain. So stroke can happen, but we call this ischemic stroke. Then we have a sample picture of it. If we look at it, we see a substance there, blackish in color, or it could be some fats that has blocked the flow of blood to the brain. So gradually the brain cells begin to die, as we see in that deep color. So most of the times this is the common type of stroke among the two types we have in the Western medicine, because out of nine strokes, so a little thing can make them to break. And one of those things that make the arteries to be hard is some drugs that we take from the Western medicine, mostly like, for instance, drugs that takes care of our high blood pressure. They tend to harden the arteries, and so easily when the arteries are hardened, any push up of blood or rush of blood can cause the arteries to break. So whenever the arteries break, this causes hemorrhagic stroke. We have a picture of that, and a sample picture of that is what we can see here. So when the arteries break, it can cause spillage in the brain cells, and then it can lead to stroke or unconsciousness. Then we have that mini stroke we talk about. This one is something not quite big because it's something that can happen within 24 hours. So it's an attack. Somebody may feel some of the symptoms of the stroke, like numbness in some part of the body, severe headache, and maybe speech problems, but within 24 hours maximum, that can go. So that one, we call it a mini stroke. So if somebody realizes that he has those kind of symptoms, it's good for him to go get medical attention, because sooner or later, he's going to have a severe stroke, either that of the hemorrhagic or that of the ischemic. So this is a sample picture of a mini stroke. You see the blood vessels, it's trying to organize itself back. So maybe this is small blockage, but then with time, maybe the blockage opens and the blood continues to flow. So it reorganizes itself back and the patient will now feel healthy again. But that doesn't mean that it's over. It has to seek medical attention quickly so that you'll be able to avoid the fatal stroke in the future. Then the brain cells will start dying, and then it will lead to like a kind of severe and chronic situation. So it affects the brain, and the brain cells will continue to deteriorate. We see from the picture of this man here, some of times the eyeballs will tend towards different fast in the vessels, they can break. So once the arteries harden as a result of drugs or as a result of accumulation of fats in the body, as we can see from this artery, it makes it easier for stroke to happen. It all depends on where it is affected, because sometimes even if it is the hemorrhagic, that's the one that ruptures, the brain vessels breaks, it can affect a small part, it can affect a large part. So diet has to do with eating poor diet, maybe a poor diet, eating too much fat and cholesterol, too much salt, because too much intake of salt at an adult age can easily lead to high blood pressure. That's according to Western medicine. So too much calories also lead to obesity, and so sometimes when people maybe finish preparing food, they add extra salt to it. These are habits or dietary habits that can lead to stroke. Then we have factors that we cannot control. For the first three, the behavior, the diet, and also the chronic conditions we can control. But for the factors that we cannot control, these have to do with getting older. No matter how good a person is, how strong a person is, with time he tends to get older, and then sometimes he cannot avoid having some deficiencies in the body or getting some sickness. So when somebody is getting older, this is something he cannot stop. Sometimes we have family history. Women are at a lower risk of having stroke. Most of the times the risk has to do with male. So male have more risk.